I will turn it over to Mary Jane Ackerman to introduce our speaker.
Great, thank you, Hope. Can you hear me? Okay. I met Lillian, I don't know how many years ago, at a Davidson County Wellness Committee meeting. And the first thing I noticed about Lillian, in addition to her really just charming smile, is that she is such a solutions-oriented person, and she is all about teamwork and collaboration. And so I knew that she would do an outstanding job as our health director, which for Davidson County, which she has been for 5 years. But I think it is with those things, both her willingness to work with other people and her drive to find solutions to problems, have made her as successful as she is as our health director, especially as we're going through this pandemic. So I'm very pleased to ask Lillian Koontz, dear friend of mine, to share an update from the health department. Lillian, all yours.
Thank you, Mary Jane. And Mary Jane, I'm so glad to hear you think I'm doing a good job, because Mary Jane was a reference for me to get this job. So had I done really poorly, we could have blamed her. But as Mary Jane said, it takes a village. And, you know, this pandemic has brought to light the absolute necessity of continuing and maintaining relationships in our community. So before I talk about COVID, I would just like to thank you, the Rotary Club, for your diligence and your flexibility in meeting remotely right now, because it's so important to maintain the initiatives that your group does and to maintain the relationships. It's so nice to hear people having what I'm calling a new normal conversation. You're meeting and you're connecting with each other about what's going on with your members in ways that are new and different, but still you know what's going on with people. As we've started the COVID-19 vaccine process, I have been so thankful to see folks that I haven't seen in a year. And that's really hard. And it's hard to measure what this is going to look like for us on the other side. But, you know, community relationships and individual connections are so important to our entire health and well-being. So thank you for continuing to meet, even though it looks a little different. And, you know, Zoom is a great tool, but it does not replace the in-person hugs and handshakes and meals. I have attended a Rotary Club meeting and the meal is fantastic. That's one of the greatest parts. So, you know, it's hard to do things in different ways that maybe aren't as wonderful, but I do commend you all for making the time to do your work in different ways. But Mary Jane asked me to talk a little bit about COVID-19, and I said, do I need a slideshow? And she said, no, you don't need one. I said, oh, good, because COVID-19 changes daily. You know, when this first started, we're almost at a year. March 19th was the first confirmed case in Davidson County. Now, trust me, there was COVID-19 work occurring before that, but March 19th is that date on our calendar that we're a year in actual local response. Since that time, our cumulative case count in Davidson County as of Monday was 14,783 confirmed cases. That number is important because it is a data point and it's something that we can track, but we also know at the health department, if a household member tests positive for COVID-19 and other household members get the same symptoms, it's about a 50-50 chance that the other household members will choose to be tested. So we know that that number, 14,783, is not an accurate number for the total cases in Davidson County. There's also a ton of asymptomatic transmission. So unless people are choosing to test for there's a variety of reasons that someone who's not sick would choose to receive a test, but if they don't have symptoms and they didn't elect to get a test, then those are other numbers that are other cases that are not captured in that number. However, again, I always share it because it is a data point and it is something that we can track. More accurate, we have 168 deaths attributed to COVID-19 in Davidson County. There's a lot of questions about that, and it is not an exact science. So when I talk to folks, I try to explain a little bit about what is attributed as a COVID-19 death. Anyone who's tested positive for COVID-19 and since that time has seen a decline in health, it's quite likely that their cause of death will be listed, at least in part, to COVID-19. But the responsibility for that determination is on the physician that either, or the medical examiner that determines the cause of death, or the physician that calls the time of death. I've talked with several community members whose family members were listed as COVID-19, and they said, well, my mom was cleared from COVID-19. She no longer had symptoms, but they listed COVID-19 as a cause of death. But when they talk back with the physician explains to them, you know, the person was at a baseline, they got COVID-19, and then they saw a decline, and they never, while they weren't infectious anymore, like able to transmit the virus had done such a number on their body that it attributed to their death. More exciting, we are at a really great number at our health department regarding vaccines. First and second doses together as of Monday, this department had administered 29,339 vaccines in our community. That is really a great number. I saw the Forsyth County number today. It was not double the Davidson County number, and the Forsyth County Health Department is double the staff of our health department. So that to me is just like, yeah, we're doing it right. But I have to say, this is not possible without partners. You know, I cannot say enough good things, and I know that it is falling on ears that know a lot about the Williams family, but Dr. Rob Williams, the apple did not fall far from the tree from Dr. David Williams, so I hear that he just has this wonderful servant heart, public health spirit, and when we realized how vaccines were gonna look in Davidson County, and that there were not gonna be a lot of providers who were enrolled initially. Bull in a china shop might be a good analogy on how Rob Williams was with what he was going to do to make sure that vaccines got in arms in Davidson County. And I cannot express how impossible it would have been to be at that number, 29,339, without the leadership of Dr. Williams. He has coordinated clinics. He's dragged in his brother, Bert, has been scheduling. His staff has been on site. Peyton has been jabbing people in arms. Like, this is a family effort, and this is great. And the family extends out of their related by family in a traditional sense to their work family. Thomasville Peds has come on board, and these individuals are typically pediatricians who provide care to children, but they have been vaccinating people well over the age of 65 and have just done it with such a caring hand, and I hear nothing but wonderful things from the work that they've done in our community. Thomasville is at a great advantage in the city for the clinics they've done. Last weekend, they did a clinic at Our Lady of the Highway, which allowed a lot of people who speak Spanish, who maybe were a little bit hesitant to get vaccines in a place where they would not understand what the majority of people were saying. They partnered with the church, and we were able to vaccinate a lot of people. People came from Greensboro, people came from Forsyth, because it was the only clinic that they knew people would be speaking their language. So I just have to say that 29,000 number is impressive, but impossible without partnerships. And we're so incredibly grateful for that. One thing I would like to share with this group is we have seen some changes in the landscape with vaccines here in Davidson County. We first received vaccines the week of Christmas, which was a really not great time to receive vaccines. vaccines. The public health department staff was pretty weary already. We've been working hard on contact tracing and trying to work with individuals who test positive and tell people who've been close to them what they need to do, working with employers. And then we see Christmas and everybody's really looking forward to whatever Christmas is going to look like. And then we get vaccines dumped on us. And when I say dumped, I literally mean dumped. The state was very elusive on how many vaccines we were going to get. I had a number of about 300 in my head, and that those vaccines were completely earmarked for emergency healthcare workers. So hospital workers, EMTs, folks like that. That's who the group was. So I thought 300. We received 2,400, 2,300 vaccines, 2,300, that's what it was. And so that was a blindside and left us scrambling. And so Christmas Eve, we were actually vaccinating folks here at the health department because, oh, look, I see Sam waving. Sam's one of those that got them. So yeah, we were doing that on Christmas Eve. And so it started us sort of behind the mark because it was hard to find people who wanted a vaccine Christmas. And so we started on a little bit of an uphill, but we got them and we started getting them out. I say that though to say the second week after Christmas, we really saw a lot of people who really wanted vaccines. We saw people checking in on social media at the health department. They were showing their vaccine cards on Facebook. It was like, you were cool. You got your vaccine. You were awesome. That sentiment is gone for the most part, which is troubling to your local health director because we, when we first started opening appointments to that group 2, so we were group 1, which things changed multiple times with the state, but where we are now, group 1 is the patient-facing healthcare providers, group 2, 65 plus. When we opened to group 2 at 10 o'clock on Monday morning, I think we had like 1,500 appointments. Those appointments filled up in 17 minutes. They were gone. And then people were really frustrated. People wanted appointments. They couldn't get through on the lines because there were just so many people that wanted the vaccine. It is 12:34 on Wednesday. We opened appointments over 48 hours ago. No, we did have a lot of appointments this week. We had 3,300 appointments this week, but they're still not full. We're very close to being full, but they're not full. And we're now vaccinating in group 3, which we thought would be our largest group. That is individuals who work outside of the home in the public. There are a lot of ways that you can ask questions about that, but the way we're determining it here at the health department, if you have a job that requires you to work outside of your home and you're not going to a building by yourself, then you are working in the public and you're eligible for a vaccine. Have to be 16 to get Pfizer, have to be 18 to get Moderna or J&J. So there are a lot of people who are eligible and our appointments are not filling up. This is alarming. We want to get on the other side of COVID-19. So we feel like locally, we had a lot of enthusiasm and spirit about those initial vaccine getters who were incredibly excited and wanted to tell everybody about it. And that has waned. Also has waned individuals who want to get a vaccine. We think, and I say we think, this is all derived from the state, and they're a little elusive about when they'll be moving forward, but we think and hope we'll be moving into group 4 next week for our appointments. Group 4 is when we're talking about adults who have conditions that make them at higher risk. Although the state of North Carolina changes things every day. So if you're wondering why you don't see more in print from the health department about what's coming in the future, it's because about the time we think we have it figured out, we get a change. And then we're trying to pull things off the website and change things. So it's just easier to go with it as it comes to us. So right now we are vaccinating individuals who are patient-facing healthcare workers over the age, or they're over the age of 65, or they work in a school or childcare, or they leave their home for their job. So that leaves out people who are working from home, people who don't work, people who have underlying health conditions, and everybody under the age of 16 is left out now because the studies have not been proven on children for the vaccines. Y'all, that's a lot of people. And with 30-ish thousand done in a county with, and that's first and second doses, so it's not 30,000 first doses. And we know that lots of Davidson County residents have received vaccines from other counties. So still though, with 167,000-ish people in Davidson County, this causes me great concern that our appointments are not filling quickly. When this first started, I shared with friends, community partners, and stakeholders the rate we were going. It would be well into August before we were able to vaccinate Davidson County. That was at a time when we had very low supply and we had very high demand. The tables have turned. Our supply has improved, but our demand has gone down. So I'm asking and begging and pleading for individuals. If you've had a vaccine, tell everybody you know you've had a vaccine. Tell everybody it's a good idea. Tell everybody, I mean, we all know you get a sore arm, but, and some people do experience some unpleasant side effects for about 12 hours. Fever, chills, that's your immunity response to the vaccine. But it's way better than the virus, y'all. And that's what the message we're trying to get out there. We need to get our community behind this vaccine so that we can go back to some sort of normalcy that we knew this time last year, back when we were still meeting with friends in public, when we were not wearing face coverings, when we could go out to eat at restaurants and every table could be full, when we could go to the movies and things like that. So I just really wanted to ask you and beg and plead with you to encourage people you know in your family, in your friend groups, in your church group, in your community group. Let's talk about getting folks vaccinated so we can get on the other side of this. And now I guess I like to answer questions if people have them, because sometimes I feel like I cover everything and then I realize I missed a big mark. But moving forward, until something changes, this department opens appointments for the upcoming week on Mondays at 10 a.m. We do that on our website and over the phone. The phone at first was almost impossible to get through. We were receiving 5,000 calls in a 6-minute period almost. And so the phone just completely shut down, but now the phone is a viable option. So 10 a.m. Mondays is when we open appointments, and we want everybody to get a vaccine. So Hope, I'm going to pause and I see if there's any questions. And again, anytime y'all have questions, feel free to reach out if something comes up after this that you weren't unable to ask.
Okay, thank you very much, Lillian. I am thinking we are going to have some questions, so you guys go ahead and unmute yourselves and chime in if you have a question for Lillian.
Lillian, it's Tom. I was at the Y this morning and spoke to someone and said you ought to call the health department to get your vaccine. And he said, well, I only want the J&J. When people call, can they have a choice?
Great question, Dr. Smith, Davidson County Board of Health member. Lovely to see you. So yes, well, yes, and we got J&J this week for the first time, and we probably won't see it again until April. There are a lot of people who want it, and there are a lot of people who don't want it. So a lot of people, there's some preference that we've seen with Pfizer and Moderna, but most people are like, oh, well, I really would have rather had that one, but I'll take this one. But J&J is a whole new ball of wax. So we clearly stated with our J&J appointments that this is a J&J event, 1-dose series, and we advertise it that way. But when we have appointments, the way it's working right now with the massive amount of vaccines that we get, we schedule a clinic day and we only use the vaccines that we have scheduled for that day, because each vaccine has a whole different slew of things you have to do with it, different needles, different storage, different handling, different times you can leave it out and all that jazz. So when we have a clinic, it is that clinic that day. Today we're doing Moderna at the health department. Tomorrow, Monday, Pfizer. Friday at the community college, J&J. So when somebody shows up, they cannot request a product, but they can look online, and we're going to do better about putting forward which vaccine it's going to be. I personally, so y'all hear it from the horse's mouth, have been hesitant. We had planned a Moderna vaccine event and the Moderna did not come in. So we had to switch to Pfizer. And so when that happened early on, I thought, we don't want to advertise which vaccine we're doing just in case something like this happens again, so we don't have people's hopes set. But now that we're in a priority group or eligible group that includes individuals who are under the age of 18, and we have J&J, our department will from here forward advertise clinics in a way that shows which vaccine they will receive.
Oh,
Yes, Don, go ahead.
I would just like to say that I talk to family all over the country, and Davidson County Health Department is doing an absolutely fantastic job of getting the vaccines out, better than anybody else I talk to.
Thank you so much. We really have tried, and I'll be honest, it has not been easy. From the very beginning, there were people who wanted us to do things differently and do it different ways, but we stuck to our guns on the ways that we knew that would work for public health, and it's turned out to work really well. Today, I had an opportunity to present at the joint House and Senate Appropriations Committee at the state, all these people from across the state, and we heard things that Davidson County across the state is being compared to Chick-fil-A in our delivery of vaccines. And I don't know about y'all, but the Chick-fil-A standard is pretty high up there. So we're really happy to do that. And it's very important to us, especially with the 2-dose products, that when folks come in for that first dose, they have an enjoyable experience. Because if things go awry and it's a bad experience, they're not coming back for dose 2. And they're not telling their friends, hey, call and go get the vaccine. So we have to do this in the right way to make sure that we get folks back for the second dose and that they tell their friends, this is easy, go get it done.
Oh,
Yes.
this is Doug Russell. I'm with Piedmont Crossing. And two things. One is I want to commend the health department for their partnership with holding vaccine clinics for our residents here on campus. And just for the benefit of the group, we are hosting a drive-through vaccination clinic on Friday from 9 to 12. And you can make appointments at our main number, which is 472-2017. It's on our Facebook and everything, but we're looking forward to it. Okay.
Thank you, Doug, for sharing that.
I have a quick scenario and with a question following it. With my cataract surgery, I went to my optometrist for my follow-up. This is in Winston, not Davidson County. And the lady the tech that was working with me is early 30s. And we were talking about the vaccine. And I asked if they were able to get them as optometrists, were they considered first line? And they were. And so I was talking to her and she said that her grandmother died in November from COVID, and her uncle died the day before, which was like last Tuesday. And so I asked her if did she get the vaccine? And then I said, no, that is absolutely none of my business. Don't tell me, I don't care. I don't want to know. And she said, oh, no, I'm not going to get the vaccine. I didn't get it. And I'm not going to. How do you convince somebody that's invincible, an early, like 29, 30-year-old, that they need it? What words can you use to do? I'm a nurse, and I'm so excited because I was able to give some vaccinations at Memorial, and that's really a cool thing. But I still don't know how to respond to somebody that just doesn't get it. I don't guess.
That is the $64,000 question. In the public health department, we are working with people of all ages, and there is vaccine hesitancy for all types of reasons. There are historically marginalized populations who have extreme vaccine hesitancy. There are young people who have that invincible status, like, I don't even want to mess with that. I'm not going to do it. And then there's people like, I happen to be married to one who has, by the way, gotten his vaccine. He is an eligible frontline essential worker, and he has it now. But he does not like vaccines because, in his mind, the sickest he's ever been is when he got the flu vaccine, and so he just doesn't need the vaccine. So I'm married to one, and I know how difficult it is to have these conversations. So The thing that I try to tell people is not only are you protecting yourself, but you're protecting other people. If you're vaccinated, then the risk that you pose to others, other people that you love, other people that you care for, other people that you pass in whatever walk of life you have, it's really better to protect other people, which that doesn't really seem to work with everyone either. And we saw that with the mask initiative, where we try to encourage mask wearing. So maybe it's not you're protecting you, it's you're protecting other people, and people still have hesitancy with the mask. So there's not a good answer, Carol. And thank you so much for your volunteer spirit with working with the clinic, because there has been a real heavy lift from folks like you who are doing this. But I don't have a good answer. I'm just hoping that over time, more people will say, okay, I'll do it. And I hope that the J&J one-time vaccine will get those people who are on the fence that just can't manage a commitment, like 2 30-minute appointments. I'm hoping that the J&J one shot will maybe bring those people on board. So fingers crossed, but we're not getting J&J again until at least mid-April from what the state's told us. So we've got some time to try to market that message and get it out there. So hopefully that will help.
Hope.
Yes.
Or Lillian, what's the time span between shot 1 and shot 2?
Great question. So there's nothing about COVID-19 is simple. Clear as mud has become one of my favorite things to say here recently, but there's 2 different intervals. The Pfizer product has a 3-week interval. The Moderna product has a 4-week interval. You can get the vaccine, well, the manufacturers both recommend you do it on that exact mark. They say the best way to get this vaccine is on that exact mark. So at Davidson County, when you get your first dose, we go ahead and schedule you your second dose that exact same day of the week, the exact same time, the exact same location, just 3 or 4 weeks later. Everybody has a life, things come up, and so we have worked around that exact mark date. Right now, you can do it 2 days ahead of time, which we have rarely done because there's just not been a real that doesn't work for a lot of reasons. But if you miss a dose, then you can get it after that time, and we try to work you in the best we can. There has not been any guidance on at what point the second dose is ineffective and then you need to start brand new with 1, but we haven't been in this very long. So we're trying really hard to encourage people to get it as soon as they possibly can. However, an example might be somebody gets their first dose and then they get COVID-19. Bad case of COVID-19. They go to the hospital, they need antibody therapy. If you get antibody therapy, you have to wait 90 days until you get the vaccine, if it's your first or second. So we're putting people way out at that point in time, but we've still been told that you can get your second dose at that time.
I have another question. How long is the vaccine supposed to be good for?
Another good question. Right now, there's no literature on that. They are not willing to put anything in writing just because it's so new. I've heard things like maybe it's good for 3 years, maybe it's good for 1 year, maybe you'll have it in your body and you'll build some sort of immunity that just wanes over time. Some people are saying it's going to be like the flu vaccine that you have to get a new one every year. We just don't know. That is something we hear often too. And so a couple of things. Number one, reinfection occurs, and this virus, let me say this too. For those of you that don't know, I am not a medical person. My degree's in public administration and biology and chemistry. So I have no nursing and no doctor behind me. But what I have heard about this virus is the symptoms that we see, the coughing, the shortness of breath, the loss of taste and smell is the least of the worries for physicians. They worry about what the virus is doing behind the scenes that we can't see. And so I would say reinfection is real. People do become reinfected. And if the virus was sort of mild for you the first time, that's what you saw, but what other damage has it done to your body? And that causes great concern. And again, back to the you protect other people when you become vaccinated. And I just don't, I mean, I don't understand why people don't want to protect other people any more than this. And I know there's a lot of reasons and personal reasons for individuals not to get a vaccine, but if we can help each other, why don't we? And so that's really where I start to lead with on that. It's not just about you, it's about everybody else.
I have another question, please. Can I be next? Okay. One of my sisters lives in South Carolina. She got her vaccine at a CVS. Are we going to have any of our pharmacies doing that? And if we do, how does that affect you all at the health department?
Great question. And yes, Walgreens is on board. So how it affects us at the health department, we sort of kind of want to do a party and a parade and yay, someone else is helping out. You know, we can't be everywhere. And I have to say, I'm so surprised at how well things are going with the number of vaccines we've done, because we are really doing this in a massive way. A Walgreens might do at most 100 vaccines a day, where at our biggest clinic, we did, I think, 1,300 in one day. And so it's a very different experience. And some people don't want to get around that many people, and they don't want to go to wherever the clinic is. So we're thrilled that Walgreens is doing it. So yes, our Walgreens are on board. There's also some other providers in our community that are on board. I saw a few pharmacies have it. So pharmacists are eligible to give vaccines. So some of the pharmacies are getting on board. But from the public health department standpoint, we couldn't be happier. We want everybody to give vaccines. They're just not easy. So I should say this too. The reason that we don't see a lot of people doing these vaccines is they are not easy to manage. That Pfizer product, I'm not even kidding, is in a box in a room at our health department with dry ice on it. That's how we're storing it. We're working out of a cardboard box because we don't have an ultra cold deep freezer. So we are pouring dry ice on that to keep the product. That is not something that a pharmacy is usually ready to take on. So the Moderna product is a little bit easier, but it comes in a vial with 10 doses. And once you take that vial out and open it, you got to use the 10 doses within a certain period of time. It's just a very fragile product. So no judgment from the public health department when providers aren't hopping on board and all the pharmacies aren't hopping on board, because it's really not the easiest product to work with.
Hope?
Yes, go ahead, Chuck.
Yeah, Lillian, thanks so much for your excellent presentation. I have two questions briefly. First question is, when people compared your performance to that of Chick-fil-A, did you just tell them it was your pleasure?
I thought it, but I didn't say it.
Second question, serious. What is the difference for the age requirement, which I believe you said was different in the Johnson & Johnson vaccine versus the Pfizer and Moderna?
The way it's been described to me in a very non-clinical way is just how they were able to get participants for the study and what it came about with. I really strongly believe that very soon there will be more children involved in studies. What we're working off right now is called an emergency use authorization. These products are not as you would typically describe FDA approved. So the emergency use requires the studies from the clinical trials that were done, and I just don't think that they had the children in them. So when Pfizer got down to 16, I think it's just who they studied. I don't think there's some significant difference that in 2 years we'll see a difference in age group. That's how it's been described to me. It's all about the trials.
Thank you.
It's all wonderful questions. We've got a couple more minutes. Did anybody else have a question for Lillian?
I do. Lillian, so two questions. One is for an individual who is homebound, so is not able to get to one of the clinics. Is there going to be a way that those individuals will be able to be vaccinated?
Great question. And yes, we are working to identify these individuals. As I said earlier, these vaccine products are really fragile. So some more guidance has come out. But when we first got them, they were like, don't put them in a car and drive them around. You've got to be really careful. So like taking our show on the road, the way I kind of envision it, like the Meals on Wheels program rolls out, where you get a whole bunch of vaccines and you just start going to houses, that doesn't work because we can't carry them across the county like that. So we have to really be very careful in how we do this rollout. It also right now, well, I've just told you how our demand is slowing, but we've got to do 3,300 vaccines in 7 days. Because of the limited resources that we have, it doesn't allow us to make these little pocket home visits. And while everybody needs a vaccine right now, the public health answer to that is if you're at home, hopefully your healthcare worker and provider has been vaccinated, because that's what we're trying to do. So they're not bringing it to you. You're not going anywhere because you're at home. So your risk is lower than individuals who are out in the community on a regular basis. But to answer your question, Mary Jane, yes, we're working with emergency management, senior services, and DSS to identify people who are homebound. And soon we will be able to open it up to some sort of way that people can call and say, I'm homebound, or they can go online and say, I'm homebound. I've fallen through the cracks because I'm not currently receiving services, but I do need a vaccine at home. And the public health department is going to make that happen.
And so if someone falls in that, should they contact senior services? Would that be the best way to do it?
I don't know what senior services would do with that right now, but I think it's a good start. I can talk with Tisha and get back with you on that. Tisha Everhart Roberts is our senior services director.
Okay. And I guess my other thing is really more of a comment just to get your reaction to, but I mean, you alluded to the fact that you get information from the state and it seems to be contradictory and whatever, but I know a lot of people, and I myself have had some issues with trying to find information on who falls into a category. And so, you know, that your explanation of who is an essential worker is different than what you look up. The people with medical conditions, if it's cancer, well, go to the CDC guidelines. It says if you currently have cancer, you're at a significant risk. If you've had cancer, you're at a higher risk. Who, you know, so I just think there's so much. I think that is a barrier to people getting, because they're not sure if they fall in a category or not. Another area, and I just saw something official on it, but it is for people who are healthcare providers, or I'm not going to say healthcare providers, but care providers for individuals who are not paid healthcare workers. For example, I care for my mother. I am her provider, but I'm not a healthcare person. So I never felt I fit in anywhere under those definitions. So I just think that there is a lot of people who maybe could be eligible, but don't know because the guidance is
clear as mud.
Yes, clear as mud, to quote Lillian Koontz.
Yes, that is an excellent point, Mary Jane. And we have tried very hard to work around that. Putting things in writing is very difficult, because once you put it in writing, then somebody sends it to the state and says, this is what Davidson County is doing. So we're doing this in a verbal way. So I told someone yesterday that I spoke with, they said, very similar to your situation describing your mom. I said, here's how we're handling it in Davidson County. If you provide care to someone and you get sick with COVID and can't care for them, and that puts them in a hardship, you're a caregiver. You're eligible. Who cares if you're getting paid or not? Because again, we got to take care of people. And, you know, very early on when we had such a limited supply, it was much more difficult conversations that were being had from this department, because we really had to ensure that the people that were providing care to people that had COVID were the folks getting vaccinated. That was our very first priority, because we're all in a mess if there's nobody at the hospital and we need to go there. So that was a very different place. Now we're at a place where a little bit more flexible. And I cannot tell you how excited I'm going to be when the state finally just says, hey, you want the vaccine? Go get it. Because this criteria thing is hard. We've had such difficult conversations and had to tell people no. And we're not ready for, we're ready for it, but we just don't like that. We want to help everybody. So we're ready for it to be, if you're eligible by your age, which is determined by the manufacturer of the product. I mean, that's a real easy one. Nope, you're not 16. No, you're not 18. But this in the weeds of, are you an essential worker? Are you a healthcare provider? We are ready for that to be gone. We as local health directors are telling the state that. So I have the highest hopes that in the next week or two at most, they just say, okay, here we are, everybody go get one.
Lillian, thank you so much. And thank you guys for all the wonderful questions. And Lillian, if you want to stick around, we will go ahead and conclude our meeting. But if we have other questions and Lillian's able to stay for a few minutes, we'll let her handle those after we adjourn. So if you guys will take a moment to unmute, I'll say thank you again to Lillian for sharing such a great message with us. Thank you guys, all of you, for your updates on our fellow Rotarians who need to be considered in our thoughts and prayers. And Kimberly Oliver, good to have you with us again today. And if you guys are ready and unmuted, we will recite the four-way test. Of all the things we think, say, or do, first, is it the truth?
Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
Okay, thank you guys. With that, we are officially adjourned. And as you guys get logged off, we will, I will ask if anybody has additional questions for Lillian. We want to be respectful of her time, but I know we did have a lot of questions today. And Lillian,
this is Doug. I've got something for Lillian. Lillian, I heard you say you're keeping Pfizer under dry ice in a cardboard box. I've got a sub-zero freezer that we bought months ago in anticipation of the Pfizer, which we end up with Moderna. You're welcome to use, and so if you want to give me a call, I'll be glad to talk to you about it. Okay.
Thank you so much. I will definitely pass that along to our immunization coordinator. That may be something that we look into. Pfizer also has some new guidance that says we might be able to keep it in a regular freezer, but that hasn't come through yet. So it could be that those two things coincide, but thank you.
Maybe actually, you know where I'm at. Okay, thank you.
Thank you.
Wonderful, Doug. I do. Lillian, I had one question that might be outside of the context of what you presented today. As things begin to, attendance at gatherings continues to increase and travel continues to increase, and even other countries opening up to travel from the US, is there going to be documentation, or do you know what documentation might be required, or what database, central database may be required? Anything on that?
So that is a really good question. And I think that we've got to have a couple more pieces of information before we're able to, and I say we as a society, able to know. If this turns into something like the flu vaccine where you've got to get it every year, that sort of thing is just not going to be relevant, because then, well, when did you have it? Did you have it? What's going on with that? Also, as we progress the days, the months, the years, a natural immunity in our herd immunity that we've maybe heard on the news will start occurring. And so the threat of COVID-19 will not be as great as it is as an emerging infectious disease. Right now, we're encouraging people to take the vaccine card that they get and hang on to it for that reason, that it may be like a card, a pass for something like that. But right now, we're not really hearing of any hard limits or requirements for that vaccine. What I have already started talking about within our agency, I don't know about y'all, but if y'all spend a lot of time in a mask, and I hate to complain about them because they're really good and helpful and useful, but it is not a super fun, comfortable thing, especially if you had onions for lunch. I mean, it's just, oh. So we want to get out of the mask. So, that's something that we're talking about at the health department. There are people here, unfortunately, who have made decisions that do not include a vaccine. But if, the guidance we're seeing now from the CDC, if everybody's vaccinated and you're indoors, there's no need for a mask. So we are hopefully going to get to a point soon where as an agency, we can say, guess what? If you don't want to wear a mask, show proof of vaccine, because with HIPAA, you can't require anybody. So this is going to have to be individually driven. But if you don't want to wear a mask, show proof of vaccine, and guess what? You don't have to. We may see things like that in other places. I know Billy was on earlier. That might be something that the Y is able to incorporate. Like if you show proof of vaccine, you don't have to wear a mask when you're at the Y. We're not there yet, but that may be a way that we use that.
Thank you.
Lillian, I just wanted to say thank you so much for your leadership. Thank you so much. I am very proud of Davidson County.
You are welcome. I tell you what, I love my job, and that just makes it kind of easy to do what you love. The hours have been long, the days are long, and the work is hard, but when you love what you do, you love helping people. And I've got the greatest group here in our building and community partners. I mean, I really highlighted what Rob's done, but Novant helped us on Saturday. They did a great drive-through clinic with the Kate Gentry and Thomasville helped organize that. It has just been people coming out of the woodwork saying, hey, I want to help. And that gives us fuel for these long and tiring days, because the energy is there and it's just really great. But thank you for saying that. I really appreciate it. But it is a labor of love for sure.
Awesome.
Yeah, good job.
Yeah, absolutely.
Very good job.
Program.
Thank you.
And thank you,
Lillian.
for all the questions. Go ahead, Kim.
Yeah, I will tell you, this is going to be posted on YouTube.
Okay.
So you can always, you're part of it, and the questions and answers are going to be on YouTube.
Great.
And I will send you the, actually, I'll give it to you now if you got something to write with.
I do.
It's R7690-6084.